Hello world, my name is Dr. Kulmeet and I'm a primary care physician. Welcome to my channel Kunlets MD. Today is December 31st around 8:30 p.m. and the whole day has been very contemplative for me. I've been trying to look what has worked this year and what we could do better. And I have come to conclusion there is a lot more to celebrate in 2023 than most of us will give credit. The title of this video I chose was Let Us Celebrate What Made 2023 Memorable. Medically, there has been so many significant changes, and I think we have achieved one of the biggest battle of this century is COVID-19. World Health Organization has declared that COVID-19 is not anymore an international concern, and they will be focusing their efforts into different matters. Telehealth is improved significantly. There has been significant improvements in the artificial intelligence. Mental health has been properly recognized, and I will be going over in detail all the initiatives which has been started globally and in the United States. Then there has been significant improvements in the vaccines, cancer treatment, weight management, and new vaccines, which has been topic of discussion for quite some time. And they will be working significantly and helping us to manage our patients properly. We have a lot of new wearable devices which will provide us information about our patients on 24-hour basis so that we could improve patient care, we can understand them better, and we will be able to take care of them in a much better shape. We will be taking care of them on 24-hour basis. These devices will keep on sending the information to our offices, and we will be able to intervene before chronic medical problems or acute medical problems arises. So let's take all these topics individually. Let's talk about COVID-19. What has been the biggest update? That now we have a reliable treatment, 95% effective vaccine, no more boosters, and mRNA technology has improved significantly that they could quickly understand the multiple variants which has been floating and changing and mutating into our communities, and they could adjust our vaccines. I know we are polarized when it comes to COVID-19 vaccines, but the science stands very clearly that the people who are vaccinated, they are 95% protected from either getting COVID-19 or, God forbid, if they get it, they will not get acute complications of COVID-19, the complication leading to long COVID, and also respiratory failure and death and hospitalization. I don't think there is any treatment which is available which will provide us with a 95% shield or improvement or protect us to this level. I know there has been some concerns regarding COVID-19 vaccine. Yes, mRNA technology was new. It was not perfected before COVID-19, but we had this technology for a long time. This technology is not new. The inventor of this technology got Nobel Prize but 15 years ago. In this technology, you're not even getting like any other vaccine, the real COVID-19 virus. It is very unique, and I will explain some other video about mRNA technology. But for this discussion, it is very safe, it is improved. Now, regarding why it's important to take the vaccine. Number one, it is very clear like flu vaccine, we will probably need yearly or depending on the guidelines which will come from CDC, we will get COVID-19 vaccine. And as we stand, the new vaccine which is 23-24, it is only one shot and you don't need boosters and it will protect you, but you have to stay alert and get the newer indications or updates when they come in. We must change accordingly. Now there is another kind of a lingering COVID, which we call a long COVID, which is keeping our people tired for a long time. They are short of breath for a long time and other multiple complications. There are about 200 different symptoms which has been associated with long COVID. And vaccine is the only thing which will protect you from that. So I cannot stress it long enough that you should consider taking vaccine. It is your responsibility to understand. I believe as a physician, we must continue to educate you and let you make an informed decision. I'm not here to change your mind, but I will say the science stands behind it and the data proves it that you should take COVID-19 vaccine. Second topic or second biggest improvement in 2023 was telehealth. Telehealth has changed the face of healthcare delivery. Now, just imagine you could get care almost the same way while you're at your home, quickly, efficiently, and cost-effective. The technology has improved significantly. Before COVID-19, the technology was very cumbersome. Now, if you need to have a televisit, you simply have to call your physician's office, or you could online schedule in most of the platform your appointment. You will get a link, you click on a link, you get your physician on the other side, and you are able to see them, talk to them, and they could do reasonably good physical exam to make a reasonable decision to help you. And I think that's a game changer. In United States, we are getting more and more physician shortages, and I think this will bridge up the gap. As a primary care, I have seen telehealth being used significantly in mental health services. I work in not a small community, but we do have fairly shortage of mental health providers, both counselors and psychiatrists. My patients are getting mental health services from 200 miles away, and they are happy they could call those providers at their own time. On the patient side, the significant improvement is now patients are using it. More importantly, they accept the treatment, and now they have added as into their tool. As a primary care physician, we have implemented telehealth to cut down number of visits, because coming to physician office for a lot of time can be done or accomplished via telehealth. Say, for example, if a patient get a blood work or radiology test, or we have seen them when we have started a treatment, the follow-up could be very easily done on telehealth, because we could give them their information, we could do so reasonable examination. So I think telehealth was a biggest improvement, and I think it's going to continue to shape the face of the telehealth. And now we are in our office, we are implementing even the specialist care. Like the patients are here and specialists who are willing to work with the primary care offices. We schedule the patient while they're there, and the specialist will come in on telehealth, and they are able to examine them. And then we could, if something special maneuver needs to be done, I could be there, do the things for them, and they're watching it, and they could make a reasonable attempt. This has improved significantly access, because now they don't have to wait for 2 weeks, 3 weeks, or months in certain cases to get a care. And once the initial diagnosis is made, and they could follow up with the specialist. Next is improvement is biggest is the mental health. Now, on mental health, there are two things which have changed significantly, in my opinion. Number one, COVID, if has taught us, it has given us time during those lockdown periods. So we at least know ourselves better. A lot of us were bored, a lot of us find out, and we are able to understand ourselves better. And further, now healthcare system has recognized mental health as a reasonable problem. It's no more that you are seeing a shrink just that you're crazy. Now people recognize stresses of life play a major role in day-to-day activity, and they are being recognized. And there is a lot of global initiatives which has been started. Next, biggest improvement is not probably relevant to United States, but on a global initiatives, a lot of countries in Africa have, with the newer medications, have been able to eradicate pretty much HIV and malaria from their communities. And kudos to them, because they were left behind in the past, but they are catching up very fast. Next biggest improvement is in cancer care. As the artificial intelligence is improving. Now conducting trials of these with these medications have become very easy because the data is now actionable. In the previous time, you have a bunch of papers, bunch of written data, which was you could not query it and you could not make any sense out of it. With this help, now there are a lot of new gene therapies, immunotherapies, activated T-cell therapies, and targeted cancer cell drugs, and then nanobot technologies which are improving. And it is expected that in coming years, we should be able to treat majority of the cancers with these new modalities, and it will help them, and our patients will live longer and happier. Next, with the gene therapy, we should be able to now eliminate sickle cell disease, Alzheimer's disease, Parkinson's disease. And if you ever have dealt with somebody with any of these diseases, they are major impediment on our healthcare system and on the patient and the families. It will be a game changer. Next biggest improvement is in weight loss. Medicare and Medicaid has been tracking people's body mass index for quite some time. It was just a number which every visit, every physician was reporting it. Now from there we have understood this weight is leading to multiple healthcare risk factors, including hypertension, diabetes, arthritis, obstructive sleep apnea, and whole slew of things. And it is not anymore that if you are overweight or obese, it is a lack of self-will. It is recognized as a disease, and a lot of good medications have come into our armamentarium so that we could use them and we could help our patients in a significantly way. And the safety of these medications have been tested, and they are being more and more being recognized that they will help. The biggest class which has been used for weight loss is we call GLP-1 inhibitors. Works in your pancreas. There is a hormone, it works there and it helps to curb your appetite. It shrinks your stomach because the food lasts in your stomach longer. You eat less and there is a less desire to eat. These medications, going with the Ozempic, Trulicity, Mounjaro, or Wegovy, these are used for the treatment of the diabetes and for the weight management. But now more and more insurance have started covering it because it's a long game. If you make somebody lose weight, their diabetes goes away, their hypertension goes away. Yes, you will have to spend money initially to bring the weight down, but you will gain on the other side, preventing chronic illnesses, which is the biggest burden. Next biggest update is vaccines. The biggest vaccine is RSV. See, imagine there are 3 main viral diseases which affect our susceptible population, which is our elderly and also our younger population. Those are influenza, RSV, and COVID. We do have very effective vaccine against influenza and COVID-19, but we never had anything good for our RSV vaccine. Is indicated for everyone above the age of 60, and this is only one-time shot. And then when we talk about the vaccine, overall the vaccination rate for COVID, flu, RSV, and shingles virus and DPT, they cross the border low. And it could be due to multiple reasons that either we as physicians have not been able to convince our patients to take it, or we don't offer them in a way that they will accept this treatment. If we just now imagine a world, you are senior and you're protected against RSV, flu, and COVID, you bound to have a good time because any of this can kill you. And I hope I'm trying to convince you that you should consider taking all 3 vaccines. Next, or the last biggest thing in 2023 is artificial intelligence. I think artificial intelligence is going to change the whole face of healthcare delivery system. Let's talk a little bit more about what artificial intelligence is and how I see or what I understand how it's going to be used in a healthcare system. First, let's start you have a chart. This, if you have been a patient with multiple chronic medical problem, and in the older days, you will see you will have this big chart. And now, if you have electronic chart, if you happen to log onto your portal, you will find there were thousands and thousands of pages of medical records. As a primary care, if you have an appointment with me, it will take me, before I come to your room, it will take me about 15 minutes or 20 minutes. Yes, I know you, I know a lot about you, but I have to refresh my everything what's going on, like any new labs or radiology test, or if you've seen a specialist, or God forbid you've gone to emergency room or hospitalization. I have to have all this data, and I have to review it and refresh it and then update it manually in your chart. This, I said 15 minutes, usually it takes longer than that, but I'm just saying because for the established patient, if we have a relationship with you for quite some time, we will know a lot of things about you. Now, with this artificial intelligence, what is the difference is your chart may have 1,000 pages. It will create a summary of those patients in a 1 or 2 pager, where I have a clear understanding of your current medications. If you saw any specialist, what they said, if you have x-ray, radiology, all those things will be significantly, I'll be able to know it, and I'll be taking care of those things. So that helps that your information is not buried down in a bigger chart. Second thing, the interconnectivity. Yes, CMS has been trying to put all the system together. All these systems need to talk, but unfortunately, healthcare is still in silos. People have different interests not to share the information, but with this AI, they can grab information from everywhere, and they could present in a way it is understandable and actionable. That's one part of it. Second, if I want to query your data, I don't have to go through pages after pages. If, say, for example, I'm a primary care physician, if I want to know when was the last time you had colonoscopy, I could, in one click, I could find all your information. Number 2, it will also make your data query so that we can act it properly and we could help you in a much better shape. Say, for example, I am taking care of a discussion 1,000 diabetic patients. We know exactly based on science, if you're a diabetic, if your A1C is above this number, you are bound to have this many complications. If you have a high cholesterol or blood pressure, now I can query it. So that makes the healthcare even better. This information is not just sitting there, and if you're a prudent physician, which most 99% of us are, we are trying to get this information and understand and make it actionable. Now this information will be on their fingertips. So that should improve physicians' diagnostic capabilities, and you should get a better treatment. Let's look at the second part. When you come to the office, we talk to you for 10-15 minutes. We have spent 10 to 15 minutes before you come in, then we talk to you, examine you. While we are talking, that whole discussion which we had, it was not meaningful. Now with artificial intelligence, if you allow, you have, this one is, the AI will listen to our conversation and it will record our conversation so that there is no you said, I said, your understanding and the physician understanding and the patient understanding is the same. It will create a proper note so that when you leave the office, I am not burdened with trying to recreate everything from my memory and do this one. And believe me, including me, have made major errors in the past, trying to recreate what I have talked to you in the exam room and going back in the office or somewhere where we dictate and creating all those parts. This is a game changer for us because it will prevent physician burden. Now, this conversation is a real time. The quality of the documentation, and also, hopefully, what I want to see is, because now I don't have to go and dictate 15 minutes after I go out of the room. Now I can spend more time with you and you will be able to get a better care. Next thing is, with the artificial intelligence, our seniors apt not to use artificial intelligence. A lot of 90% of our seniors are now texting. Now with the chatbots and all those things, you should be able to get very clear information and should be able to talk to us real time, and you are not tied down to the passwords or calling us and all this part of it is. I'm very sure as we go along, this artificial intelligence, if used properly, should help us in taking care of you better. Diagnostic studies will be more useful and the treatment options will be better, and you will get an accurate diagnosis, and we will have a less physician burnout and burden. Next thing is in primary care, which is a game changer, is the wearable devices. Say for example, now we have glucometers who are checking your glucose 24-hour basis. Previously, checking sugars was difficult, it was painful, it required a lot of skills. Now, it is recording your sugar, it will alert you when you're high. You could check if you ate something wrong and your sugar is going up. That's it, instant feedback, and you will be able to take care of yourself in a much better shape. Same way, the blood pressure machines, now they are Bluetooth enabled, or it's a lot of devices which are coming which have a cellular device built in, and you take a blood pressure, I will get your blood pressure reading in the office, and I will know whether your blood pressure is controlled or not. And I could tell you from my personal experience, I made an effort this year is that I'm going to use a lot of continuous glucometers wherever possible. If their insurance allowed and my patient can afford it, I've been able to lower people's hemoglobin A1C, which is a marker of control of your sugar, by 2 points just by feedback that you know what you eat wrong and when this thing happened. And I'm talking about the people whom I never believe will take care of themselves. Further, in primary care, as I mentioned, mental health has taken a significant shape. We are able to now manage them. The mental health questionnaire has become like PHQ-2, PHQ-9, screening you for alcohol, smoking. That has always been there, but now we are putting a lot more effort to do this one. Then management of the chronic diseases like diabetes, hypertension, I just now alluded to it, that is already improving. So in a nutshell, if you put together all the new technologies which are coming online, I think we have a very good time in healthcare. It is good to be alive at this time so that we could enjoy these technologies and we could improve. But in the end, the final message is, in the United States, the biggest challenge is our lifestyle. We don't exercise, we don't eat right, we smoke, we drink, and I think this societal changes needs to happen. It is recommended now. Everybody knows that nobody should smoke and drink. There is no discussion on that part. It is recommended that every adult should strive for 150 minutes, meaning 30 minutes 5 times a week exercise. Manage your stress, manage your chronic medical problems, and I am very, very optimistic that with the new technology, newer medications, if we add lifestyle change, I think that will improve face of the earth, and we will be living longer and healthier. This is the common discussion which we have. In healthcare, eventually we're going to lose everybody. But the goal is not to lose. Goal here is the lifespan you have. You should live quality life. You should be healthier, enjoying this part. But I think if you change your lifestyle, plus all these innovations, new treatments, I think it's good time to be alive. In conclusion, I want to say that 2023 has been significantly empowering as far as healthcare is concerned. Things have gotten much better. We continue to make improvement. At least in 2023, COVID-19 is not of international health concern, and we have proper treatment, proper vaccinations, new devices are coming online, new modalities for our long-term chronic problems, whether it's a diabetes or cancer, are coming in time. Let's all join together. Let's improve our healthcare by changing our lifestyle. I think that's the fundamental key component. If we change our lifestyle, we will improve. I hope this video was helpful. I am ending 2023 with being humble and full of gratitude. My personal goal in next year is to serve you better and to be a better doctor. Thank you very much. Please do subscribe to our channel because it helps us to continue to produce quality content. Thank you very much.